everybody, I feel the need to say Elizabeth. Because that's what she calls me, but it's Liz. We're here doing an interview with my mom. So my mom has been a nurse for more years than I've been alive. Put a poll up on Instagram and on here to do just like questions with her. She's done a ton of stuff and a lot of you said yes, you want to see it. So I put all your questions down and we're going to try to get through as many as we can. Yep. So this is my mom. Hello. So we're just going to go through the questions. So what kind of nursing have you done?
Med-surg.
What was your first job?
Oh, back in the day, they put new nurses in the float pool, if you can imagine. So I floated across the hospital. So it was my first job. So everybody survived. So that was great. So we did ER, peds, the nursery, med-surg, oncology.
So it's kind of like how that is now, but now you would be in a CSR or like a cluster for like acute care or like med-surg, but they made her go to like...
to the wolves. But we survived. And then I did telemetry. I really liked that. A short stint as home health while I was getting a perioperative nurse certificate. That wasn't my favorite. Then I worked in the OR for a long time and I really enjoyed that. Did school nursing and I finished up in OBGYN Triage for very large OB practices. And I liked that.
And when you did telemetry, what was telemetry like? Because it's probably different from how it is now.
So the telemetry monitors were on that floor. There was no telemetry anywhere else. Everybody that was monitored was there. And as nurses, we had to run all the strips. So you had to take time, an hour a block at a time unless you worked nights. And then you did multiple hour blocks, pulling and reading all the strips.
And it was all on paper.
And it was all on paper. You had to get up and push the buttons if you saw an arrhythmia. So we were like, that was challenging.
Yeah. So
I learned a lot.
Having worked on a cardiac floor, I can't even imagine that because then it beeps at you, that horrible beep when it's something bad. Did it even beep back then or did you just...
Alarm. We had to turn the beeps off because at night there was only one nurse reading the monitors. So you had 35 monitors with a flashing light. So you're trying to catch them all. But we didn't lose many. And we had to pull the strip.
It's much more skills based. We're spoiled now. What cases did you usually see when you worked in the OR?
I worked at a level 1 trauma center and so the OR was divided into groups. So I worked in the med-surg group, kind of, not med-surg, I guess, more general surgery, I guess, but we did livers, we did liver transplants there, we did big abdominal cases. It also, oddly enough, had the craniofacial group. So we did big trauma that came in, skin flaps, because the plastic guys were with us, so we did huge skin grafts. We also did hand reattachments, like digits and things like that. So we did big bellies to a lot of microscopes for those hand reattachments and things like that. And then we had a float with a large OR, so it was 33 ORs, main OR, so we got pulled all over the place.
She worked on the one where they chopped their face off and you like...
Oh, faceless, yeah, just different, so those things. But yeah, so we did transplants, livers and kidneys and hearts too.
What was your least favorite and favorite surgery to scrub into?
I liked really big bellies, livers, things like that. My least favorite probably were those big microscope cases because you can only look one part. The physicians had the microscope and they went on for hours and hours and you couldn't really see anything.
Did they even do laparoscopic surgery back then or was it all?
So just down in GYN a little bit. But most of everything was a big open abdomen.
Okay, then you were in the OR and then what? Then I was born.
Yeah, and then her sister was born, Rachel. So then I did school nursing after that, after they were, Rachel I think she was 2, right? I think I went back and started doing that and I did that until, gosh, you were in high school. And then I went to OBGYN Triage,
Yeah, she worked at my school as the school nurse, which was beneficial in some aspects because if you were sick, you could just go and lay on the cot in her room and sleep. But it was unbeneficial. I don't even know if that's a word. She was also while she was the school nurse, she was also like the dress code monitor, so we had a dress code at my school. And so you can bet I was really popular since my mom was the one that came around and checked if your skirt was short enough or long enough. And it was just so fun. She also did the emergency preparedness, like the school was getting
accredited.
That's the word
for the Western states
to be like emergency certified, and then you have to get all your healthcare certification stuff in order. And she did that. And tell them about the earthquake drills.
Well, we lived
in California,
so you got to do earthquake drills. They were part mandatory for accreditation. So I used to. So I've gone to many seminars, and one of them said that children were frightened by the sound of earthquakes because of everything falling. So you were supposed to make think of a giant rain stick, but with all manner of debris in a large can and shake it. So they would associate the sound with seeking shelter, like, duck and cover wherever you were. So I thought it was fun. Yeah.
Sometimes your mom would just walk in the room shaking a huge coffee can of debris and everyone would run under their desks. And it was
Because earthquakes happen without any warning.
so there's that.
Hey, it stopped class for a while. Everybody, I think, liked it.
It did.
They loved it.
Okay, so you did that until I was in high school, and then you went to OBGYN Triage. And what did you like about that?
All the patient teaching. I think you had a large impact on women's lives from across the spectrum, from young girls, teenagers, our pregnant moms, through menopause. So we did lots of patient teaching there.
Yeah.
And that was really, I enjoyed that a lot.
And then you did 2 practices, one there and then one in Michigan. And then now she's retired.
Yeah.
Yes.
Taking a break from nursing after all this time.
Do you think you'll ever go back to it?
I don't know. Not at this point, no.
When working in the OR, how did you handle difficult surgeons and coworkers? Not that surgeons are ever challenging.
So I think for the coworkers, that you weren't going to get along, sadly, with everybody. But I just tried not to antagonize them. Like, we all know things that really set them off. To try not to do those. And if you could find one point of common ground with them, sometimes you had that one point. But some people were just going to always sabotage me to challenge. But I didn't try to push all their buttons on any given day. That was a sure recipe for disaster. And surgeons, like she said, I don't know if you've ever worked with really challenging surgeons. Some are always going to be really challenging, and that never changes. But I thought if you really prepared ahead, knew what they wanted, when they wanted their, whatever, all their things, if you're really familiar with the procedures so that they didn't have, that helped go a long way. At least maybe they could respect you. And I thought that helped. And some of them you weren't going to please. But I thought just being really prepared, and they learned to respect that they could count on you, and I think that helped.
Yeah. And just being more knowledgeable about
the procedure what they're doing, your anatomy,
and that way you can
why are they doing it, right? And
figure out, you can predict, which is good in all fields of nursing, is kind of, if you know what's going on with your patient or what surgery they did have, that if you understand the physiology of it, then you can always predict better what can go wrong, which is something I always used to do when I went in at the beginning of any shift, is I would look at my kids and I would say, or my adults when I worked there, what would I expect to go wrong with these kids, and then you can kind of watch for it, which would be, I think, huge in the OR.
Yeah, especially for big trauma cases, like, who would I might need to call, or what vascular surgeon, just things you need to bring on board, I guess.
Yeah, and she actually did and I don't know if you even do this anymore, you did a perioperative certificate before. Correct. So she did her home health. She was working in that. She did that so that she could go back and get like an additional certificate on top of her RN.
Yeah, because the ORs didn't want to do quite as much in-house training at the time. So you did this course which laid all the, scrubbing the techniques, just different things. So when you went in, they didn't have to start from ground zero, even though you had to learn all their procedures, but it saved them some time. And that was just, now I don't think they do that.
No.
I think they want
now they have like residency programs usually when you go in the OR, and you owe them a chunk of time. Like they train you for 9 months, 6 months, whatever, and then you usually owe them like 2 years. Because you do have to train them. It's a totally different type of thing.
It's very labor intensive. It's a lot to learn, and it's totally different because you don't really do it in school, so there's no way to adequately prepare.
Yeah.
And everything is very surgeon and hospital, somewhat specific.
Yeah.
They have very set ways that they want to
I think you did more probably then than they do now. Because now I think nurses circulate, or
I bet they don't.
There's a lot more assistant, like there's very specific, you can be like a tech in the OR, and they do a lot of the scrubbing.
The state law requires nurses to circulate and stuff. So, but back then we had to do both.
And not all surgeons are mean. Just throwing that out there. Some are very nice. Yeah, some are great. It's just like everyone. There's some mean nurses and there's some mean surgeons, and they can be the challenge.
Some are really fun. Right.
Yeah, and some are really fun and nice. Why didn't you become a physician?
At the time, I just didn't really have any desire for that time commitment and to do it. I just didn't. I think if you're going to be a physician, you really need to do it for the right reason. And I was not motivated to do it for that. And in hindsight, I think my life skills, like patient teaching and just those interactions with patients and everything, played much better to my personality and the things I really enjoy doing. As anyone can tell you, I like to chat. And it served me well, but physicians, they don't have time to do that. And that's not, so I think I would have felt frustrated in that.
And that schedule's demanding. So a lot like how I would never be able to work part-time now. I mean, if that had been what I wanted to do, you would have never had the summer off when she was like in school nursing and everything.
Which was great.
Yeah.
Our family lived on the other coast, East Coast, so it was fun. We had a lot of fun.
What are some of the pros and cons of nursing? So we'll do the pros first.
Well, I've relocated a lot, and I've always been able to find a job, satisfying jobs. That's been great. I do not like to be bored, so nursing has endless possibilities, and if you find that you're getting a little burnt out in one field, or it's like, I've moved around like you can see, and I really enjoyed that.
And there's a lot of different options you had said.
Oh yeah, just what job has it where you can change, even if you're willing to put in the time, because all field changes are stressful at the time, but you can just go into a new specialty and it's like a whole new learning experience for you, and different people that you interact with and can impact, I think, in their life. So I just found that I really liked it.
Yeah. And what about the cons?
The cons, I think, the holidays perhaps. I didn't so mind doing different shifts particularly, but I didn't have problems sleeping and adjusting. I didn't get affected by working nights. I know a lot of people do, and that's really hard, but that never particularly bothered me. One of the harder times is you have children, you want to take vacations, is you can't get the time off. Like in the summer, you just can't get your time off that you would like to schedule because shortages, even probably short nursing. So juggling that balance of having time off.
Yeah. What shifts, since you mentioned that, did you work?
I worked all of them. Back in the day when you started, now you have a lot of set shifts. I did work permanent nights at first when I was on that RN pool. Yeah, they put us all on nights. Then when I moved to Philadelphia, we on telemetry rotated. Everybody rotated all 3 shifts. So you could have that was wild. So you might work 3 to 11. And it wasn't like you'd always go then, like maybe into nights, because you were kind of on that. No, you'd pull some days. And then from days, you might go to nights. And so you did them all.
That's not good for you.
No, but we did.
Did you like night shift when you worked it?
I did. Mm-hmm.
How was that different from day shift?
I thought night shift allowed us to be more autonomous. As you know, your supervisors and head nurses aren't there. And I had a different camaraderie, I thought, during nights, which was, if you worked with those people sometimes in the same group, I thought that was really nice. You had just a different, more of a group feeling than sometimes in days.
It's a good place to start, I think, because I know a lot of new nurses I didn't want to go on nights, when I started, but I know a lot of other people talked to me and said they don't, but I think it's like a very a group. You're all miserable together. And so you're just kind of get through it, and you create good bonds with your night shift people.
Plus you learned a lot. I don't know, you got a lot to do.
Yeah, since there's not the resources there. You kind of have to just
learn
stumble along.
I just think back from my telemetry days, the skills that I learned on night shift. You might only get a couple in a day because you wouldn't have the patience to do it all.
Yeah. And your manager not being there is huge. You all know how I feel about that. What was your favorite nursing job?
My favorite nursing job was when I worked at Penn in their big OR. Very fast-paced environment. We saw a lot, did a lot. It was one of the best nursing, support nursing jobs I've ever had. The head nurses, the managers, they very, very supportive of nursing there. That made a huge difference.
And then she had me and I ruined it.
Well, then I went to work in a smaller OR, which didn't quite have that support, but still.
What made you leave bedside nursing?
I don't know, I just really wanted to work in the OR, and I can't even really explain why. I guess, I worked on telemetry. We saw it. The OR nurses would come up sometimes and talk to us about those open hearts and just different things, so I just thought I would like to try it. And then once I got there, the OR is a place I think you really love it, or you dislike it, and I liked it. I just liked it. And
then you left the OR for school just for kids.
Well, we had moved to California, and it was just challenging trying to find the child care that worked out with the huge time commitment, because you couldn't do part-time and then they were requiring you to start to be there for a long, long time. So I did, the school nursing, so we could have our summers off to go back to visit family or just have time.
We lived in California alone, so the rest of our family lived far away, so there was no one to watch us during the summer or ever.
Yeah, we would have had to pay full child care for 2 young children, and that just was not going to be.
We know how that goes. I've complained about that a few times.
Yeah, so I started at part-time. I did half days, so Rachel, her sister, could go to just half-time preschool by then. They had a really early preschool program.
So really, Rachel ruined it. That's the moral of this story. I didn't ruin it.
Yeah, I think I started when you were in kindergarten.
What do you think of early or direct entry NP programs when you don't necessarily have to work as a nurse before you become an NP?
I'd probably not be in favor of them, only because of the experience that you gain out on the floor. You're going to be much more responsible for the outcome of patients, their life. And I think you gain so much experience seeing the different how things are managed. I mean, not only are you a nurse, but you're watching how the physicians manage those, what medicines work, what treatments actually work. And I think that can really shape how you go on to practice. And I think it gives you some, I mean, I worked in telemetry and you worked with heart. So just from people having like just really emergent situations, I think it helps you to be calmer in dealing with those and being able to think through the processes there. And without that, I think you might get a little panicked, I guess. And just too, like I went in, when I was out of school, I really always wanted to work in a coronary care unit because that's what I had done all my research on in school. But then, like I said, I ended up in the OR. I liked telemetry, but I ended up loving it, which I wouldn't have learned if I hadn't done other things and been exposed to different things, I think.
Yeah. And I think you definitely, when you see people who come into the office, I think I wouldn't be as good as identifying, like, you are ill. You know what I mean? Like, something does not look right here, and I don't know exactly what it is, but you are too ill for me to do anything with you in the office. You need to go to the emergency room. And I think a lot of those feelings have come from having people who you go in their room as a nurse, and you're like, oh my gosh, and they end up like coding, or you need RRT or something very quickly after that, and they just have a look, and you can't really describe it, but just from seeing it hundreds of times, you can kind of be like, ugh, like, this is not good. And I think it matures you a lot too, which we had talked about, just doing a lot of like bedside nursing or whatever kind of nursing you do. It matures you in a provider-ish role, just from having
all that experience.
Yeah, you have an education background. Like, it gives you a background in so many things that even if you only do it for a couple of years, you have to be an educator, you have to be a patient advocate, you have to learn all of these things.
I think it makes you more comfortable dealing too, like when you have like difficult patient situations, unless you have been in that and practiced on just dealt with difficult people. But there at least you have a backup to rely on. And sometimes I think when you're a provider and you run into those situations, if you're new, it's hard to be firm or to take that. But you've seen other people do it when you're on the floor and you're like, yes, I can do that.
Yeah.
And that's the best answer for them, actually.
And I ran into that recently at clinic. The woman I work for is a physician, and so she's used to seeing a lot of like med students right after they pop out of med school. And she said it was funny because I'm kind of probably more tenacious than maybe your average person, but you get very used to saying no when you're a nurse because you just have to. And I am much better and more comfortable at saying no than I think some of the people I've talked to who are in like PA school or definitely med students, because you want to make people happy and you don't want to be like, nope, you can't have that. But you learn pretty quickly, I think, to say, nope, you can't have that. And be comfortable and present it in a way that's not just mean.
Not offensive, but this is really what's best for you. And that takes, I think, practice.
Yeah. You have to practice being mean.
You have to sell being, not sell being.
What was your least favorite nursing job? We kind of briefly talked about it.
Home health. My parents were both in hospice, and people that provide home health, just on that end, I just was not my gift. But man, they do such a great job. And I just do think, like, our own mom, sometimes we had to have home health come in or whatever. They reached a fantastic service. I just thought, just for some reason, was not my...
It's a great thing, but not for... Like, I would never want to do the OR. I can't handle bones. What is your favorite specialty?
That's hard. My favorite place where I worked, I guess, was the OR.
That counts.
And even though,
And what is your least favorite?
Now, this is odd, since I did OBGYN Triage, which is very different. I could never, ever work in labor and delivery. No, couldn't do that, which is just very interesting. People think, they're one and the same, but they're not. It's a very, very specialized little niche, and I don't think I would enjoy doing that very specialized thing. No. Our office covered, like I said, from ages, we said 13 up to 90, and with a gamut of problems that was new and different every day.
Did you like the pregnant, like that thing over the phone when you triaged it, or were those never your favorite?
Believe it or not, OB was not my favorite, only because the stakes were so high and you were doing it on the phone and you had to make some really difficult calls. The schedules were very full for the physicians. You try to find line to bringing them in, trying to triage them on the phone. Expectant moms are rightfully very, very nervous. So it's
not anymore.
It's very difficult to come out always on the top in those. Yeah. You have to always err on the side of caution there. So I think that was what the stakes were, just so much higher with the baby and mom.
How fun was it triaging my pregnancy?
I thought I did an excellent job and I almost did nothing. I want you to know. She was Surprised, right?
I was.
Really? Because I've had many patients who are nurses that told me their moms drove them absolutely bonkers. And their dads were too sick. So I tried
both
to
the
just...
times that she told me to go in, I did need to go in. So
She
one was-
called.
Yeah.
I didn't. I tried to be good.
Did nursing take away a lot from family time, and if so, how did your family adjust to the schedule? So we kind of talked about that a little already.
Yeah, early on we just did our holidays and things at different times, stuff like that. And then after we moved to California, then I switched to school nursing, so we were still able to come back in the summer and stuff. I thought that was a good life balance. You take a job like school nursing, perhaps wasn't my all-time favorite, but I did enjoy it when my girls were younger. But it was for that life family balance. And then when you guys were in high school and could work longer out, whatever, I went back to the triage.
Did you get your associates or your bachelors? Or you could get a
A
diploma?
diploma. So back in the day, most people did the 3-year diploma school, so the nurses, they were on the floor all the time, but they didn't have all the classroom. But it was just the time of when they were starting to roll into a bachelor's. So I decided that I would get a bachelor's degree. So it was challenging because we were looked down upon, if you can imagine, because we didn't come out as adept at all the clinical practice. Like now you're just used to that there's a learning curve. And the diploma girls didn't have that. But I think over time, it has served me, of course, really well. And now everybody, I don't think there's
There's no diplomas
at all.
Now
So
it's
it all
associates
transitioned,
moving to
right.
bachelors.
So that's how it was back in the day.
It's interesting because now we're in a different, then it was the diploma to this, and now it's the associates to this. And the associates kind of reminds me of the diploma because they are so much more clinically focused. Like you don't have all of those other 400 level, theory, all the what I'd call garbage classes to get your bachelor's.
But it did help you if you want to go on to touch. You do research,
yeah.
and I think it helps you with your research. Like just if you're gonna anything, it gives you that. So
you need it to move on.
You need it to move on.
And I highly recommend getting your bachelor's, even if you, depending on where you live. Some people, if you want to just get out and work, I think if you do your associates and you are living in an area where you can work while you get your bachelor's, and obviously you would make a lot more money than if I was a waitress or whatever. That would be good, but I think getting your bachelor's as your end goal would be the way to...
It opens a lot of doors for you down the road. And even if you don't think you want it now, as you get more mature, you might say, oh, wow, I wish I could do that. But you need that. You do need that as your stepping stone. Yep.
Have you ever considered an advanced practice nurse? So a APRN, an advanced practice registered nurse, just in case you don't know, that's a NP, a CRNA, which is the nurse anesthetist. Their midwives are one, like a CNM, and a certified nurse, CNS, like a certified nurse specialist, which I will be the first to admit, I don't know a lot about CNSs. But they're very good at what they do. They usually are on an inpatient unit where they're like the go-to person for inpatient nursing stuff. But anyway, did you ever want to be any of those?
No, back when I was thinking about it, those didn't have all of those. And there really were not that many practicing nurse practitioners in independent practice. Those were just starting. So if I'd stayed in the OR, I think I would have wanted to be an RN first assistant. If you're not in a large hospital, we had them in many rural hospitals because they really needed someone to help assist and do the retract and just, different things. And so probably that would have been, that last one, the nurse specialist, I don't think that sounds, I bet they would do a lot of teaching of staff and stuff. So nowadays, I think that would have been, I would have found that one very
They're like the resource, the education resource that they go out and they basically look at all the research that's out there for nursing, and then they compile it and integrate it how you can implement that on your unit.
I think
is what they do.
Yeah, that would have been interesting. Those things did not exist. Most people were going back to it to teach, or you could do it and be like a patient educator in the hospital, but it was kind of a transition period. So most people went back for administration, which I would not want to have done that. Or really, we're going to go back to ultimately to get their doctorate to teach nursing.
Have you worked with an NP or a CRNA? And if so, what did you think of them in general in terms of their work ethic, knowledge, and did patients respect them?
Oh yeah, I worked with a lot of nurse practitioners in women's health, gynecology. They have a lot of. In fact, I never worked with a PA in that field. They were all nurse practitioners. They did a great job. We had patients who would only see them. They were totally loyal to them. It was hard talking them out of it when you knew that they were going to have to see a physician because, their problem was just that emergent at that time. So, no, we did. I worked with a lot of nurse anesthetists. I didn't work with a lot of nurse anesthetists. Well, I did in the OR, and they were all, the ones I worked with were fantastic, and they were good. And I have been treated by a nurse anesthetist in Michigan when I had my hip, and she had a lot of nausea, and she had the best plan of care for me that I've ever had, and did not come out of their nausea. She made great suggestions, who I give to every place I go, and they always look at me, and I ask them to implement it because it was effective, and that was by a nurse. That's, you know, yeah. So she did great.
So you said that you felt like NP, sometimes going to like an NP or someone rather than a physician when you have like a young girls in your OB practice, they had more time to kind of, they were more approachable almost sometimes.
Often they were,
because they had more time.
They had more time, and a lot of them also had been moms. So I think they felt more comfortable. You know, young girls don't come in, they don't speak medical terms, they're intimidated often by figures of authority, and I thought they had a little more of a laid-back approach. They could speak to them in a just a more down-earth way. So I thought the girls were more open. I could often talk them into coming to have a hard with the nurse practitioners than I could often with the physician. And so I thought they had they had more time. They didn't run on sometimes such a tight rein, and but often they had a really good rapport with the young girls, which you want them to come in, you want them to be seen, but so I thought that worked out well. Yeah, and usually, because people say a lot that like NPs have more time with people, and that's usually just because certain things have to be seen by a physician. So a lot of like the teaching, like the education, like, hey, I'm interested in birth control, or I'm interested in, you know, like new patient, whatever, they can go to an NP because they're not coming in for, you know, if you're coming in and you have twins and something's not going right, they're going to go see the physician rather than usually the midwife because it's high risk. And so that's why usually when people say like... Yeah, and even in gynecology, if you were coming in and you had extensive postmenopausal bleeding, I was not going to put you with a nurse practitioner because we're probably going to have to... There were a lot of things we were going to have to go up and probably maybe do procedure-wise, and that wasn't... And they weren't going to be able to do that. You know, they weren't going to... If we needed surgery or something, that wasn't going to happen. So some of those cases that were then going to require a lot of time, whatever, we didn't put on their schedule because they weren't ultimately going to be able to follow through with it.
So that's when people say like NPs have more time, it's usually, or midwives, it's usually because of that. Because
right, so if somebody came in and it was a bad OB thing, why? Because they're going to have to make a decision whether they're going to have to take this, whatever, deal with the baby in a much more critical situation. And they were the ones who were going to have to deal with all the on-call stuff, so we did not put those on the nurse practitioner schedule.
Yeah, so that's why. All right, I think this is going to wrap up round 1. I think it's going to become a 2-part thing because we still have quite a few that we've not gotten to. So this was part 1 of the interview with my mom. If you guys are new here, I'm Liz. I have a weekly vlog that I do. I'm a family nurse practitioner, so I'm just documenting life through that, and then I do one of these nursing videos once a week. So if you're into that, think about subscribing below. And I have an Instagram where I do like bits throughout the week about what I see in clinic. Do you have a question of the day? We always ask a question of the day.
Oh my.
I'm putting her on the spot.
What's your favorite ice cream?
What's your favorite ice cream?
We've been trying ice cream spots around North Carolina.
They're visiting, and so we're trying out all the different ice cream spots because we're very healthy.
As you recall, we did that when they visited State College.
Yeah. So here's our life theme. So what's your favorite ice cream flavor type? Whatever. All right, and make sure to stick around for part 2 because we have lots of good questions in that one too. All right, bye. We'll see you later.